Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about why it's important for everyone to supplement omega-3s. This one is critically important, especially for vegans and vegetarians and those with a restricted diet. There is so much to know about the omega-3s, and their benefits are remarkable. The confusing part of this whole picture is that many of us never eat fish, they never take fish oil, and they appear to be in good health. I want to help you understand that dichotomy, how it is that taking a little extra fish oil would help those people attain a level of health they're not familiar with. It's really quite interesting and very powerful research. That's our concept for today. First, let's go to our news. Let's see what's happening in the health world. Low vitamin D levels increase pain and narcotic pain reliever use. Researchers from the Mayo Clinic evaluated 267 chronic pain patients. They found if the chronic pain patient had low vitamin D levels, they were much more likely to be taking larger amounts of narcotics such as morphine, fentanyl, or oxycodone to control their pain. In fact, the study found pain patients with low D levels took twice the amount of narcotics on average. Pain is the leading cause of disability in the U.S. The study was published by Pain Medicine. Related research from the Federal University of Sao Paulo finds, from a review of existing research, supplementing vitamin D along with restoring quality sleep helps to better manage pain-related conditions. They also found maintaining higher vitamin D levels makes other pain management tools more effective. The study was published by the Journal of Endocrinology. Well, isn't this amazing? Increasing vitamin D levels helps to better manage chronic pain. Now, our good friend and past guest, Dr. Leslie Ray Matthews, trauma surgeon and vitamin D researcher from Morehouse School of Medicine in Atlanta, Georgia, was so impressed with this research that he emailed it to me so that we could include its results in our daily health news. Well, thank you, Dr. Matthews, as I know many will benefit from the newfound knowledge that vitamin D helps our bodies to better deal with painful conditions. Let's review what we have learned. People who live with chronic pain have more pain if their blood's level of vitamin D is low. They also have worse self-perceived overall health and physical function. The correlation was so strong that those in pain with low D levels took on average twice the amount of narcotic pain relievers. Now, one last finding. They found as BMI or obesity increased, the level of vitamin D decreased. The reason for this is that vitamin D is stored or trapped in our fat. When it's stored, it can't be used to help strengthen our bones, joints, and muscles, and it can't be used to help calm inflammation, which is the real driving force of most chronic pain. We also learned from the review study there is sufficient evidence now to recommend almost all of those with chronic pain should take steps to improve their sleep and increase their vitamin D intake. So what's our vitamin D goal? Strive for a blood level of at least 50 nanograms per deciliter. Most can attain this level by supplementing between 4,000 to 10,000 units of D3. The best way to determine your D3 dose is by doing blood tests. And I must add, there are a few of us who should not take extra vitamin D, those with hyperparathyroidism or sarcoidosis, for example, among a few others, but these are a small minority. Memory and healthy brain aging are linked to omega-3 and omega-6 fatty acids. Researchers from the University of Illinois have discovered from 2 new studies having a proper balance of omega-3s and 6s from both marine and vegetable sources play a critical role in fluid intelligence and memory with aging. Past research has defined a clear role of the omega-3s DHA and EPA in healthy brain function. Both DHA and EPA are found in abundance in oily fish such as salmon. The new research finds that certain vegetable sources of both omega-3s and omega-6s also play a role in brain health. The study was published by Nutritional Neuroscience. Well, folks, this one is important. It takes a little explaining. You know, I've always felt, as many of you have, that we're missing something when we state that we must eat fish or supplement fish oil to receive brain benefits from the omega fatty acids. The advice goes on to imply that only the omega-3s, DHA, and EPA found in fish provides brain benefits. Well, what about vegetarians and vegans? These people do not consume any fish or fish oil, and yet studies show they live about 7 years longer on average than meat eaters. So what gives? What are we missing? Well, this study helps us to better fill in these gaps with proper understanding. This study found that vegetable source oils such as flaxseed and avocado's omega-3s, alpha-linolenic acid, and stearidonic acid, along with the vegetable source omega-6 eicosapentaenoic acid, play a critical role in the brain's frontal-parietal region that provides fluid intelligence. Fluid intelligence is the ability to solve a problem that you have never encountered before. If you do not have these critical vegetable source omega-3s and 6s, your ability to live independently will be compromised early. Also, these vegetable source omega-3s and 6s play a critical role in the proper function of the brain's fornix region. This central white matter bundle of nerve fibers plays a vital role in forming memories. And again, if we do not have enough of these vegetable source oils, our brain's ability will be compromised early and we lose our independence early. Now, past research has also shown that we are capable of converting these vegetable source omega-3s and some 6s into the critical marine-associated DHA and EPA. So now we better understand how it is that you can be perfectly healthy and live a long life and yet never once eat fish or take fish oil. Vegans, you can now breathe freely, but you still need to supplement your B12 and minerals. Oh well, we all need to do that anyway. Well, today on Your Health, we'd like to further discuss the health benefits of the omega-3s. The list of these benefits may surprise you. Stay tuned to learn more. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
This is why Bioinnovations offers two products, the fish oil complex and omega-369. Today only, buy a bottle of either fish oil complex or omega-369 at the regular price and get an additional bottle free.
Most of us need to supplement with omega-3 rich fish oil. Fish oil contains DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan, boost omega-3 to get back in balance.
Again, today only, you get 2 bottles for the price of 1. Buy a bottle of fish oil complex or omega-369 and get an additional bottle free.
Give us a call at 888-442-2128 or order online at bioinnovations.net.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Our health depends on the choices we make every day, and few conditions are as dependent on our choices as diabetes. So here is your daily diabetic checklist. Number 1, take your diet seriously every day. Eat lean protein and leafy vegetables. Number 2, sugars and starches raise blood glucose, so reduce them in your diet. Number 3, check your blood glucose and record the readings every day. Number 4, take your medication daily and don't skip. And number 5, try to exercise every day. It will help you take off weight, which will help your body regulate blood sugar better. If you are diabetic, this is your quick daily checklist that could make life better. For Your Health at a Glance, I'm Dr. Richard Becker.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
Welcome back, everyone. It is such a blessing to be with you today. Well, today's show is going to be quite informative. We're going to learn all about the importance of the omegas in our diet. This one is just great. If you want total vibrant health, you've got to make sure you get those omegas, and they have to include EPA and DHA today. We're going to learn why. So, Richard, the essential fatty acids.
Yes.
What are these?
Well, it's a bunch of chemistry is what we're going to talk about, and we're going to make it as easy as possible so we can all benefit. And this can be a confusing subject, and our purpose today is to make this understandable, because there is truth in this scientific knowledge that can relieve your pain, improve your mood, help your health outcomes improve dramatically. And in some cases, when we supplement these omega-3s, it's like night and day for many people. So let's try to understand what we're talking about. Scientists, nutritionists have discovered that there are two basic omegas that are required for health. It's like vitamin C is required, vitamin D is required for health. Well, there's two omegas that must be in the diet in order to have life be present. The first one is alpha-linolenic acid. That's an omega-3. Let's just call it ALA for short, ALA. This is an omega-3. It can be found in avocados, flaxseed, grass-fed beef, lamb, and even pork. It is not the omega-3s associated with the marine EPA and DHA. Now, the notion is that the ALA, we ingest it into our bodies, and then our bodies will convert it to EPA and DHA, the same as the marine source. Okay, you with me so far? Now, there's another essential omega, and that is an omega-6. It is linoleic acid. Linoleic acid, LA. And this is common in vegetables and meats. When you fry something in corn oil, you're getting a lot of this omega-6 linoleic acid. And I want you to all be aware that there are others. There's a long list of these fatty acids, but these are the two that early nutritionists figured out are the essential ones. And then we take that ALA and convert it into the health-promoting EPA and DHA. And this is important because many of you do not like fish. Many of you have never taken a fish oil capsule in your life, and you're over 50 years of age, and you say, what's the big fuss? Why do I need to take this stuff? I've never had fish. I've had it a couple times. I'll have a little catfish, but that's it. I never take that stuff, and I'm fine. Are you? Are you really that fine? Well, let's take the knowledge a little further. We take that alpha-linolenic acid, ALA, and our bodies convert it. Just how well does that work? That's the big debate. And what scientists have come to understand, that we do convert to EPA and DHA, which provides all these benefits we're going to talk about here in a minute, but it's a very inefficient and slow process. So our overall efficiency is like 0.4% efficiency into the EPA and DHA. What this means is if I have 1,000 molecules of alpha-linolenic acid, ALA, only 4 get turned into EPA and DHA. Only 4 out of 1,000. And what we've also learned is that men are less efficient at converting than women. Women are much more efficient in converting the vegetarian sources or the veg like flaxseed. All right. Now, on the other hand, we must realize that this process, even though inefficient, is constant and ongoing. It never stops. So even when you're asleep, there's a little trickle of this conversion to provide for our brains and our hearts all these special effects that the EPA and DHA creates for us. So when we say, I don't need that, I don't need to supplement that. I've done fine for years. Nobody in my family ever does that, and we don't have any problems, do you? Really? Are you sure? What this has led to is a long series of studies, hundreds, even thousands of studies, to determine if taking extra EPA, the marine-based EPA and DHA, actually provides benefits. And to help us understand that a little better, let's start with a quiz. Yeah, maybe you don't supplement your DHA and EPA. Maybe you never eat fish. But take this quiz and let's find out. Give yourself a point for each one of the positive answers. Like, for example, do you have dry, itchy skin, particularly in the winter? If you say yes, that's a point. Keep track. Write these down. Dry, itchy skin. Now, everything dries out in the winter, but you are much more susceptible to dry skin in the winter if you're low in your omegas. Do you have brittle hair or nails? Do they break easily? Do you have slow, delayed wound healing? A nick on the finger takes a couple weeks. It should seal up in 2-3 days. It should go quicker than that. Do you have any type of clotting issues? As we get older, our skin gets very thin, and we'll see elderly people with blood clot or bruises all over themselves. Is this you, particularly if it's happening at a younger age? Do you have muscle loss? Are you much weaker than you used to be and have a hard time explaining it? Do you have high blood pressure? Some 80 million Americans do. Do you have high blood pressure? If so, give yourself a point. Are your triglycerides high? Have you been told that you're pre-diabetic? Triglycerides high, cholesterol high. Do you have an arrhythmia of your heart, irregular heartbeat? Give yourself a point. Do you feel like as though you have poor circulation, or as the doctor said, well, your circulation's compromised, it could lead to problems for you? Give yourself a point. Is there a family history of cardiovascular disease? Even if it's a heart attack at 75, it counts. We want to live to be 90 and then just pass in our sleep one night. That's the ideal, isn't it? And this is what we're talking about, having 10 years of suffering before we pass, or living a long life with very little suffering and then Jesus takes us in the night. That's the ideal. That's what Grandpa did at 99. That's what I'm attaining for all of us. If we can pull that one off, that'd be special. So is there a family history of cardiovascular disease? Give yourself a point. Is there a history of heart attack, mini strokes, or even a stroke at all? Is there attention deficit hyperactivity disorder, or the inability to concentrate? You're out there, you can't focus on things, and and you're feeling stressed out, and you just, oh, I don't know what to do with it, okay? Chronic depression, irritability, anxiety, any of those, excessive fatigue and stress. Give yourself a point for each one of those. You can legitimately say, yeah, I struggle with that. You know, we all have tough days. Those don't count. This is a pattern that's established in your life. Worsening or change of your vision. And this could be a dramatic change, and it can be a sign of this problem. Here's a big one that many of us have. Do you crave fatty foods? You just got to have the chips. Maybe there's salt involved as well, but you crave the fat. You need the fat. When we're low on these critical omegas, our bodies say, you need to eat some fat, buddy. We've been told fats are bad, which is not true. Sugars are bad. Refined starches are the bad ones. When you're craving fat, it means you're malnourished. Do you have that? Many of us do, and it drives obesity in America because we've been told fats are bad. Well, some are, but most of them are not bad at all. Most of them are good for us. Do you have trouble with constipation, irregularity, low fertility, especially men, low fertility, joint pains, aches, arthritis, weak bones, osteoporosis? Do you have any chronic inflammatory conditions such as arthritis, bronchitis, colitis, any of these itises? Give yourself a point. Do more than 50% of your meals come from outside of your home? Did somebody else prepare most of your food? 50%. Are you cooking them, buying the raw ingredients, cooking them, or are you counting on somebody else to prepare those? Well, we're off to these important messages. You add up your score, and when we return, we'll grade your test and see how you did. We'll be right back. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
This is why Bioinnovations offers two products, the fish oil complex and omega-369. Today only, buy a bottle of either fish oil complex or omega-369 at the regular price and get an additional bottle free.
Most of us need to supplement with omega-3 rich fish oil. Fish oil contains DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan, boost omega-3 to get back in balance.
Again, today only, you get 2 bottles for the price of 1. Buy a bottle of fish oil complex or omega-369 and get an additional bottle free.
Give us a call at 888-442-2128 or order online at bioinnovations.net.
I'm Dr. Richard Becker for Your Health at a Glance. Does acid reflux keep you hooked on antacids? If so, you may be suffering from GERD, which stands for gastroesophageal reflux disease. GERD affects at least 20% of the adult population. In fact, Americans spend hundreds of millions of dollars per year on medicines to treat GERD. This is unfortunate because these medications have side effects. They can cause additional digestive problems, and they lead to nutrient deficiencies, such as the depletion of vitamin B12. Fortunately, there are simple lifestyle changes that can reduce the symptoms of GERD. Avoid lying down or exercising within 2 hours of eating. Lose weight because obesity worsens symptoms. Limit foods that cause GERD, such as fried, fatty foods, mints, chocolate, and caffeine. To improve digestion, eat a diet rich in fiber, yogurt, and drink lots of water. For Your Health at a Glance, I'm Dr. Richard Becker. There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone, discussing the importance of omegas in our diet. Well, now let's see how we scored on that quiz. So, Richard, how did we do?
Yes. If you had 1 or 2 points on your quiz, you're doing quite well, and you have a low likelihood of omega deficiency. It is also possible that you eat fish on a regular basis, or you eat grass-fed beef or poultry, or, you know, it's a healthy organic food source. If you have 3 to 5 positives, you're in the medium range. You should make some changes. Supplementing, eating healthier, and you'll do better, you'll feel better. If you have more than 6 or more, and you're in that zone, you're in trouble. You better do something quick. And just because nobody in your family eats fish doesn't mean you don't need it. This is the thing. This is the difference I really want to get across to people. You may make 50 and never touch these special EPA, DHA, omega-3s. You may do that, but you're not going to get away with it forever. I saw this over and over again in our practice. People who say, well, I don't want to eat that stuff. I've never eaten that. I have my burgers and chips and I'm fine. Well, no, you're not. You've been in here 5 times in the last 6 months with colds and flus and bronchitis, and now you're developing arthritis. We need to make some changes. It's in your own interest. I'm trying to get this across to people. Now, so back to this notion of I don't need to supplement these. Here's what the science says about this. What I did was I went to the current scientific literature and took the last 100 double-blind placebo-controlled trials on supplementing fish oil. This is EPA DHA, eicosapentaenoic acid, docosahexaenoic acid, these special marine-based omega-3s. These are the things that we can convert our ALA to, but we don't do it very effectively. Now, the point is this. If it makes no difference, then these studies wouldn't show any benefit to the EPA DHA. Make sense? I want to make sure everybody's with me. Does that make sense? All right, let's see what the studies say. First is cardiovascular disease. If you supplement the omega-3s, EPA and DHA, this is what this is all about. It reduces triglycerides. Each one of these statements is a separate double-blind placebo-controlled study in a peer-reviewed scientific journal. Top-level evidence. Omega-3s reduce triglycerides. It reduces the risk of sudden death from cardiovascular disease. It delays cardiovascular death, disease-related death. It reduces heart attack risk. Separate study, Imagine all the work it took to do all this. It reduces plasma viscosity and red blood cell rigidity. That allows blood to get into all the nooks and crannies and do its proper job. It improves blood flow. That's the poor circulation concept. It improves heart rate variability. The heart should change its pace ever so slightly when at rest. That's a sign of a healthy heart. And if it's going steady like a metronome, that's a sign of a problem heart. It's just the opposite of what you think. Heart rate variability is a good thing, and if you're not getting enough omega-3s, EPA, DHA, you don't have good heart rate variability, and that means if you have a heart attack, you're much more likely to have a fatal arrhythmia and death. But omega-3s reduce that risk. Also, heart variability of the heart at rest and during a stress test. You perform better on a stress test. Reduces the risk of heart attack after stent placement. And cardiac syndrome X by improved blood flow. Cardiac syndrome X is when you have heart pain, but there's no lesion in the coronary arteries. There's no apparent reason why your blood's being blocked to the heart, and yet you have angina, you even have a heart attack. It's a bit mystifying, but you're going to have less trouble with this problem if you take omega-3s, regardless if you're a good converter. That's the point of all this. Reduce oxidative stress in the cardiac syndrome X, lessens the risk of stress-induced heart attack. I'm thinking of the executive who's burning the candle on both ends. He's trying to build a dynasty for himself and his family. Good intentions, but he is stressed out. What good is he going to do dying at 53 and leaving the family without a father? See, these are things we can help. EPA reduces blood clots in men, and DHA reduces blood clots in women, and it does it by reducing platelet aggregation. The platelets are the little snowflakes that plug up the tears and the holes in the little capillaries, helps to control hemorrhage. But if they become sticky, they cause emboli clots that can lead to heart attack, stroke. The omegas reduce that stickiness. That is the essence of all of this prevention of cardiovascular diseases. The EPA and DHA reduces the markers of inflammation known to predict high risk of sudden death. Indicators that you're at risk for high risk for a sudden cardiac death, those are reduced. It improves endothelial dysfunction in smokers. That's basically high blood pressure in smokers. It helps to reduce that. It improves cognitive performance in people with heart disease. Reduces the risk of cardiovascular disease and diabetes, even in seniors. And you think you don't need this stuff? Really? Improves heart rate variability and chronic heart failure. Review of double-blind evidence. Omegas reduce the risk of fatal coronary artery disease. Reduces the risk of heart attack death. Again, sudden cardiac death reduces cytokines and markers of oxidative stress. But these are the things that inflame the artery and lead to the breaking loose of the emboli that causes the heart attack. You calm those inflammatory markers, you're at less risk for heart attack. And omegas do that for us. They also lengthen the telomeres of the white blood cells. Telomeres is the agate at the end of the DNA sequence that controls the replication of the cell. If the white blood cell can continue to live and replicate itself, your immune system stays healthier and vibrant. This is different than leukemia. This is a normal process of perpetuating and continuing immunity. The omega-3s help that. Next, reduces the risk of AFib after cardioversion. You've had the AFib, you've had the cardioversion, you want to stay in normal sinus rhythm, take your omegas. Better chance of it staying in good rhythm. If vitamin E and C are added to the omegas, it reduces post-op risk of atrial fib. This is a interest of mine. We have far too many people with AFib, far too many. Long-term use of the omegas improves gene expression of anti-inflammatory pathways. In post-heart attack patients not on statin, reduces the risk of second heart attack. Now, not everybody can take statins, right? In fact, I think most people take them needlessly, but that's a whole nother subject. If you can't take the statins and you've had a heart attack for whatever reason, maybe it causes you joint pains, maybe it makes you muddle-headed. If you add the omega-3s after a heart attack, it reduces your risk of a second heart attack, which is all good news. So, are you getting the drift of this? I hope I'm not being pedantic and as they say, beating a dead horse, but I hear this so often. I don't need to take the fish oil. I don't need to do that stuff. I've never had to, and I don't think I'll have any problem. Well, the science says you will have a problem, and if you supplement now, you're going to be at lower risk of all these things. Now, that was just the cardiovascular disease. There are also brain benefits that we can introduce before our break here. The omegas, this is where we really see a pronounced difference in many things. It improves the psychosocial behavior in adolescence. Think of all the young people today who maybe they don't have a strong family unit, maybe they don't have role models, maybe they need to have a job and they don't have the job, but they become defiant. And it leads to truancy and all these problems. They've studied this. If we give these kids the omegas, that behavior gets better. We'll be back with more. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
This is why BioInnovations offers two products, the fish oil complex and omega-369. Today only, buy a bottle of either fish oil complex or omega-369 at the regular price and get an additional bottle free.
Most of us need to supplement with omega-3 rich fish oil. Fish oil contains DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan, boost omega-3 to get back in balance.
Again, today only, you get 2 bottles for the price of 1. Buy a bottle of fish oil complex or omega-369 and get an additional bottle free.
Give us a call at 888-442-2128 or order online at bioinnovations.net.
I'm Dr. Becker, and this is Your Health at a Glance. Are you one of the millions of Americans who are at risk for heart problems? If your diet is like the average American's, you're getting far more sodium than your body needs, and this may create serious problems for your heart. A new study from the Netherlands showed that a diet high in salt not only increases blood pressure to dangerous levels, it also causes damage to your blood vessels. To avoid these problems, you need to avoid foods that are high in salt, such as preserved and prepared foods like frozen dinners, canned soups and other canned foods, cured meats such as lunch meat, hot dogs, bacon and sausage, condiments and sauces such as soy sauce, teriyaki sauce, and spaghetti sauce, and snack foods such as salted nuts, pretzels, and chips. Eat fresh fruits and vegetables, fresh meats, poultry, fish, and other salt-free alternatives. As you decrease your intake of salt, your desire for salty foods will eventually be reduced. For Your Health at a Glance, I'm Dr. Becker.
You've heard the news that the nutrients CoQ10, L-carnitine, D-ribose, and magnesium promote cardiovascular health. And now you're looking for quality supplements you can trust.
Dr. Becker's BioNutrients provides you the highest quality heart-smart supplements. Dr. Becker's BioNutrients CoQ10 and L-carnitine feature BioSolve technology, which promotes maximum absorption of these critical cardiovascular nutrients.
That's right. Feel the BioNutrients heart-smart difference when you start your journey to better heart health today with Dr. Becker's BioNutrients CoQ10, L-carnitine, D-ribose, and magnesium.
Just ask for Dr. Becker's Heart Smart Plan at BioInnovations, and we'll help you get started today.
Give us a call at 888-442-2128 or order online at bioinnovations.net. That number's 888-442-2128.
We're back, everyone, having a great discussion on the importance of the omegas in our diet. Isn't this interesting information? And to help you get these essential fatty acids, we have a great special today. This one's a little more involved because there's choices. We have basically, at BioInnovations, 3 different types or ways that you can get your omegas. We have the fish oil complex, we have the omega-369, which is a blend, and we have the flaxseed oil, which is a non-fish source. And all of these, whichever one you choose, you can get a buy one,
get one free today only. That's where you buy the first bottle at the regular price. You get a second bottle free, and that, of course, is of the same type. So whichever one you want to pick, you get a buy one, get one free. I hope I said that correctly.
You did. It was perfect.
And I tell you, what a way to get these in your diet, Richard.
Well, it is, and it's important, and we should always look to the future for our health and prepare for tomorrow's inevitable health challenges, because we will all have them.
Yeah, when you get to the appropriate place in the show, too, explain how you can take more than one type.
Oh, yes.
And when it's buy
Mix
one,
and
get
match.
one free, why not?
Why not?
You know,
It's a
add
good
a
way
little
to do
bit of
it.
this and a little bit of that for different
Yes.
things.
So what we've been discussing is the latest 100 double-blind placebo-controlled studies showing the merits of supplementing the marine-grade EPA DHA. This helps us to understand that we are not efficient converters of the vegetarian or vegetable or even meat source, red meat source of these omega-3s. We don't always convert them well. If we all converted well to the EPA DHA, these studies wouldn't be true. They'd see no difference. Our bodies would take care of it naturally. So the point is also that we can go many years without supplementing and do quite well until the inevitable happens. Time catches up with us and we have problems. And sometimes it comes very quickly. We were talking about neuropsychiatric benefits to the marine EPA DHA, improved psychosocial behavior in adolescents with borderline behaviors. You know, if you have none of this stuff in your body, within 30 days you'll be in a desperate way. Desperate way. It is essential for life, these omega-3s. Please don't discount that. So the kids who don't get enough of this, they have aggressive, borderline personalities. And if we take the omega-3s, we decrease our risk of psychosis in these kids. In young patients at risk of psychosis, they reduce the occurrence or progression to psychosis with less negativity and fewer psychiatric symptoms. How many kids go to the doctor and let's say they're a young adult, 18, 19, 20, and they have borderline personalities, and they're wondering, mother and dad are wondering, how is this kid going to fit into society? And does the doctor even once think about the nutrition? 95 out of 100 times in America, that's not happening. We need to think of this first, folks. We have to change the way we approach the treatment of disease. We can't just use drugs over and over and over again. Oh yeah, sometimes it works well, and sometimes it really helps with symptoms, but it's not getting the underlying problem. It is the mission of my life work to help you understand this. What else can it do for us? Less negativity, fewer psychiatric symptoms, overall, while it improves response to antipsychotic and antidepressant medicines. So you can take the omega-3s with medications when appropriate, and it makes the medicines work better. They do different things, see? They don't do the same. They're completely different actions. And it works best when we integrate our methods. That's the best method of all, is use whatever works the best. The omegas in the neuropsychiatric field lowers biomarkers known to represent beta amyloid plaque. In other words, Alzheimer's, dementia, slows the progression, reduces the biomarkers that represents the level of the amyloid plaque that is the hallmark of Alzheimer's and all the neurodegenerative diseases. Now, the fish oil, does it cure Alzheimer's? No. No. Does it cure Parkinson's or ALS? No. But it slows the progression. And when you complement it with vitamin D and magnesium and curcumin and some of the other things, and B vitamins, that's very important, and good exercise and mental challenges, you know, continue to take on the challenges of life, we can make a big difference in the onsets of dementia. We can delay it for years and stall its progression. Makes a big difference. What else? Improves memory and reaction time in healthy young adults who eat a poor diet. Young adults who eat a healthy diet, how rare are those? Hen's teeth. Improves depression scores in depressed senior women. Improves short-term and working memory, immediate verbal memory. Delayed recall capability in seniors. You know, I tell you something and 20 minutes later I come back, can you tell me the 3 things? You'll score better if you take your fish oil. See, these are all things to help us decide when you can't live on your own anymore. That's what we're talking about here, folks, seniors, is your independence. This is how we prolong our independence. If you have ADHD, you will improve your scores in kids and adolescents and even adults. ADHD, attention deficit. EPA provides greater improvement in depression scores, improves reading skills and behavior in underperforming kids over time, improves Ritalin's effect in kids, hyperactive kids. You can take the fish oil, you can take the DHA, EPA, and the Ritalin if necessary. You can do both. You get better results that way. Let's go on to obesity and diabetes. We're talking about the benefits of supplementing our fish oil. Higher doses of omegas, 7 grams a day, which is not exceedingly high. Talk to any Inuit native northern person. They eat tens of grams every day of fish oil. They survive off this stuff through their long winters. 7 grams a day is not that much. It's not a drug. It's not that much. So if you're fighting obesity, take the higher doses of fish oil. It'll help you feel satisfied, and that's been proven in studies. You're more likely to lose weight if you take the higher doses. Helps with weight loss, reduces superoxide free radicals in diabetes, helps to calm the inflammatory profile of the diabetic. It reduces the overall inflammation in sedentary and overweight middle-aged adults. It reduces ventricular arrhythmias after a heart attack in the diabetic. It improves blood lipids in the diabetics, and it improves the histology of the fatty infiltration of the liver in the pre-diabetic state. All that's just for diabetes. When we return, let's talk about the advantages in obstetrics. We'll be right back. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
This is why BioInnovations offers 2 products, the fish oil complex and omega-369. Today only, buy a bottle of either fish oil complex or omega-369 at the regular price and get an additional bottle free.
Most of us need to supplement with omega-3 rich fish oil. Fish oil contains DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan, boost omega-3 to get back in balance.
Again, today only, you get 2 bottles for the price of 1. Buy a bottle of fish oil complex or omega-369 and get an additional bottle free.
Give us a call at 888-442-2128 or order online at bioinnovations.net.
Here is our hope for you today. I'm Cindy Becker. Christian counselor Dr. Henry Brandt wrote, "To dwell above with the saints we love, that will be grace and glory. But to live below with the saints we know, well, that's another story." Throughout our lives, we encounter difficult people. These souls challenge the best of us. But the Apostle Paul suggested that we maintain our grace in spite of the actions of others. Paul wrote, "If it is possible, as far as it depends on you, live at peace with everyone." Paul acknowledged it may not be possible in all cases, but we should still do our best. Try to look at difficult people through Christ's eyes. Remember his sacrifice was for everyone, even those saints we know who challenge us. I'm Cindy Becker. This is our hope for you today. Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone, learning so much about the importance of the omegas in our diet. And to help you, I want to go over that special again because it's a big one. At BioInnovations, we have 3 different ways that you can get your omegas. We've got the fish oil complex, we have the omega 369, which, as you know, is a blend, and then we have the flaxseed oil, which is a non-fish source, though it is still in a gelatin capsule. It is a non-fish source for those who want a plant-based source of the omegas. Whichever one you want is a buy one, get one free. You buy 1 bottle at the regular price, you get a 2nd bottle free, so don't miss that one. So Richard, I know for myself, I take the fish oil complex and I also take flax. And I think the flaxseed gives me a lot of other benefits, which I know you'll cover. But it's just to say you can mix them up.
Each one of those has its unique properties.
It sure does.
They share properties, but it has its unique property as well. We've been talking about obstetrics and gynecologic advantages of supplementing your marine type omega-3s. In PMS scores drop dramatically over time. This is a time thing. It's not like a drug. It doesn't work quickly. But over 3 months, 6 months, PMS scores improve dramatically. Better concentration, less bloating, less headache, overall pain decreases, less pain medicine, less time in the with cramps. The whole thing with the dysmenorrhea, it improves over time. If we add vitamin D, curcumin, and inositol to that plan, ladies, the dysmenorrhea is going to get so much better. Help the young girls understand how to manage their periods. Let's repeat that. The omega-3s, vitamin D, curcumin, and inositol, IP6. Tremendous for dysmenorrhea, tremendous. PCOS, polycystic ovarian syndrome, decreases insulin levels, improves glucose control, also improves the likelihood that you will ovulate. DHA given to mothers improves fetal heart rate variability and newborn baby behavior. They're more consolable. They're happier babies. And the benefits are tremendous for babies. Gestation goes longer. Baby develops better when we have DHA and EPA supplementation. Let's go to neurology real quick. Urology and nephrology, chronic renal failure, chronic renal disease. The omegas are very important to maintaining the glomerular filtration process. And we want to include that in part of the renal failure picture. It helps to prolong the use of your kidneys. I would strongly recommend you get Dr. Rich Snyder's 2 books on this subject and read it and become very familiar with these concepts if you have kidney disease. Various effects, sickle cell disease, these poor kids, they have the sickle cell crisis. They have better outcomes in sickle cell if they take their omega-3s. It's the membrane of the red blood cell. They are less likely to have a sickle crisis if you give them omega-3s. Less infections, less pain medicine, the whole thing. It's really quite remarkable what it can do for the sickle cell patient. Also, the inflammation of the lungs. This study they looked at 87 different natural molecules and ways to calm the inflammation of the lungs in asthma. The omega-3s were among the absolute best natural remedies or drug remedies. They looked at what we're doing to treat asthma. The omega-3s help asthma remarkably. But there's no drug company behind this. There's nobody spending $1 billion a year advertising on your favorite TV program to tell you about these benefits. But these benefits far exceed any drug ever devised. I've been studying this my whole life. Please believe me. And if you don't want to buy from us, don't. I don't care. It doesn't hurt my feelings. Please get on the omega-3s. What else? CRP levels improve. That's your propensity to be inflamed. Okay, that's the new stuff. Now, from previous research, let's go through some of these quickly because they're just impressive. PMS, we talked about, less risk of preeclampsia for the mother, improves the IQ of baby. If mother supplements during pregnancy, baby has a higher IQ, and it's from 7 to 10 points. That's a scholarship. That's getting into a better school, a better job. That's more income throughout your life. I'll take all the intelligence God can give me, please. Better eye-hand coordination, better eyesight, and a lower breast cancer risk the entire life of that baby. Entire life. Just from taking a little, or eating a little salmon. Everybody's worried about the mercury, and I am too. But see, that's one of the great benefits of supplementing fish oil is we purify it. We take all that junk out. It's been distilled and purified, so you don't have to worry about that anymore. Kids are less obese. Autistic scores improve in autistic children. Adults are less obese who supplement. Children and adolescents and adults with fewer psychiatric problems, including depression, ADHD, bipolar, and even schizophrenia. Schizophrenia rates drop in populations that consume a lot of omega-3s. Respond better to medication, reduces the inflammation of diabetes, improves glucose control, reduce rates of cardiovascular disease, including lower blood clots. These are previous studies that we've covered over the years. Lower rates of inflammatory bowel disease with fewer episodes of painful bowel inflammation. You know, it acts up less. We're talking about ulcerative colitis, Crohn's disease, and even irritable bowel syndrome. You'll have less trouble with it. Reduces the risk of Alzheimer's disease and the neurodegenerative disease, and it slows their progression. Lower rates of age-related macular degeneration, vision, lower rates of autoimmune disease, and less outbreaks of inflamed joints with autoimmune disease. It's like 30 to 40% lower. Fewer joints are inflamed and fewer episodes of flare-ups we call them. Counters the effect of neuroexcitotoxins. These are all the pollutants and chemicals in our environment now that inflame the brain. MSG is a good example of that. Aspartame, a wide variety of these that we ingest on purpose, inflame the brain. You'll have less trouble with that. Slows the progression of osteoarthritis. And don't forget, the Old Testament tells us that we should eat non-scavenging fish with scales. We're talking salmon here. And I always think about Christ's miracle of the loaves and fishes. Now, this was whole grain, whole wheat, bread, and healthy fish. Why would he use that as an example to feed the 5,000? Something to think about. We'll be back in just a moment. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
This is why BioInnovations offers two products, the fish oil complex and omega-369. Today only, buy a bottle of either fish oil complex or omega-369 at the regular price and get an additional bottle free.
Most of us need to supplement with omega-3 rich fish oil. Fish oil contains DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan, boost omega-3 to get back in balance.
Again, today only, you get two bottles for the price of one. Buy a bottle of fish oil complex or omega-369 and get an additional bottle free.
Give us a call at 888-442-2128 or order online at bioinnovations.net.
I'm Dr. Becker with Your Health at a Glance. Have you or someone you love recently been diagnosed with cancer? It is projected by the year 2020, some 18 million Americans will be cancer survivors. The main reason for this upward trend is our treatments for cancer are better than ever. Our cancer medicines are much improved, and we know more about how cancer works. In addition, holistic principles of cancer care are becoming standard of care treatment. Plus, research centers are discovering natural substances with true benefits for the cancer patient. This is an age of wonder, as we can incorporate both mainstream medicine and the fields of complementary and anti-aging medicine into your plan to beat cancer. I'm a cancer survivor who's here to tell you that you have more tools than ever in your battle with cancer. For Your Health at a Glance, I'm Dr. Richard. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all four in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. I just want to give you a quick reminder about that amazing special today to help you get the omegas in your diet. We have 3 different ways to get the omegas: the fish oil complex, the omega-3 6-9, and the flaxseed oil. Buy one, get one free, so don't miss it out of whichever one you want. So Richard, I know time is short. We like to say start with your diet. So how can we get these essential fatty acids in our diet?
Well, everyone's concerned about getting excessive mercury in our diet, and that must always be remembered and minimized. The longer a fish lives in our great oceans, the more likely they will have mercury in their bodies. All fish have some mercury, but high toxic levels of mercury come in fish that have lived a very long life. Some of the larger fish, such as shark or swordfish, marlin, ray, gemfish, tilefish, orange roughy, and there are others, large groupers, this type of thing. They may have been alive for 50 years, 75 years. Sharks, I thought, maybe even 100 years or more. No one has really studied them for that long a time to know, but they do know from studies and testing these larger fish that the bigger the fish, the more likely they have high toxic levels of mercury. So we need to minimize that. So avoid those older, large fish. What do we focus on? Salmon is one very good fish. It's near ideal for our purposes here. And the oldest lived salmon is something like 7-8 years, and most of them even shorter life than that. So salmon, herring, sardines. A sardine may live 2 years, if that. Very short reproductive cycle. Tuna, the smaller tuna, not the great big ones. I watched the program on TV where they fish for the huge tuna, and they catch one 500, 600 pounds. That's what you don't want to eat. Now, those tuna are very expensive, and they make sushi out of it. And I'm sure it tastes great, but that's where we're getting our mercury, folks. That's one of the main sources, so I'd be careful with that. Smaller tuna is a better choice. Mackerel and, of course, trout is a good source of the marine grade, and it is your one freshwater fish that is known to have higher levels of EPA and DHA. And we call those the long-chain fatty acids, marine-based EPA and DHA. Now, how much of this do we need to take? The bare minimum is one nice 3 to 4 ounce serving of salmon a week. That's the bare minimum. Anything less than that, oh, I'm a little concerned. I recommend everybody take at least 2 grams of fish oil a day, or your alternative, such as flaxseed oil. And there are others to do, but what Cindy's given us today, that's what we would start, at least 2 grams. And if you're struggling with a health condition, I would push that up to tolerance. And maybe it's 5 grams a day. Maybe it's 6 grams a day. Maybe it's even 10 grams a day. I remember one day Dr. Sinatra, cardiologist, sat right there and told us, I take 13 to 15 grams of fish oil every day. And his whole life has been about trying to save people with heart disease. I think that's a good example. Now, maybe we don't all need that much, but at least a couple grams a day, and have fish whenever it is a good thing to do. Well, Cindy, an interesting program today. The dietary fatty acids provide multiple health benefits above and beyond our ability to convert from the other omega-3s into these long chains, EPA, DHA. It's worth it. The science says there are true benefits, and you can take advantage of those benefits as well. Thank you for your kind attention here at Your Health. Hope to see you tomorrow. Bye-bye, everyone.
Thanks, everyone. We'll see you tomorrow right here on Your Health. Bye-bye.
I never wanted to be associated with heart disease. I never wanted to be the poster child for heart disease. I never wanted people to know that there was something wrong with me.
Going through recovery from open heart surgery or being affected by heart disease can be incredibly isolating.
It's not easy on your body, on a woman's body.
I felt really alone because no one my age really had this problem, never had this issue.
And just knowing that there's a circle of women who know